Hello, and welcome to this quick guide on how to recognize the signs and help your kid recover from a concussion. We all want to do everything we can to help our kids stay safe and protected, but even with all of our precautions, injuries are bound to happen. It's easy to see when kids scrape their knee or twist their ankle, and you already know exactly what to do to help them feel better. Whether it's a band-aid, cast, brace, or sling, there's usually a simple fix to help your kid recover. But one of the worst injuries that a kid can get is one that cannot be seen on the outside. This is a brain injury or a concussion. Luckily, the brain has many layers of protection around it. It is first surrounded by three membranes called the meninges, and then surrounded by fluid that helps protect the brain from damage, in addition to the bony skull that holds the brain inside it. When we get little hits to the head or perform normal activities that involve a lot of head movements, the fragile brain tissue in the skull is cushioned by the fluid and the membranes to protect it from harm. However, a hard enough hit will cause a concussion. While kids play soccer or any other sport, they are exposed to the possibility of getting hurt. Although we should not be fearful of these injuries, it is important to be aware of how a concussion can occur on the sports field and how to best help your kids if they do get hurt in this way. Let's look at what actually happens inside the head when a concussion occurs. When there is a hard enough hit against the motion of the head, the brain continues its momentum forward, pushes through the fluid, and slams against the inside of the front of the skull. This impact between the soft brain tissue and the hard interior of the skull causes a concussion. The brain can even bounce back and hit against the opposite side of the skull in addition, causing two direct locations of brain injury. So if your kid gets hit on the head for any reason, it is very important that this injury is taken very seriously since the extent of the injury on the brain cannot be seen. This is especially critical if the injury happens on the sports field. There are many characteristic signs to look for if your kid gets hit in the head that would indicate they could have a concussion. These include dizziness, blurry vision, confusion, and sickness. If you notice any of these symptoms, ensure that your kid is removed from the sports game, gets lots of rest, and seeks medical evaluation if their symptoms are severe. A common misconception is that someone only has a concussion if they lost consciousness when the collision with their head occurred. This creates problems for young and professional athletes that dismiss a damaging hit to the head as not a big deal and continue to play in the game with a concussion. If the player returns to play immediately, their injury can worsen due to movements of the brain that make it hit against the skull and cause further damage. If your kid gets a concussion, it is important that you continue to assess their mental well-being for a few weeks to ensure a full recovery. There are some long-term symptoms that could affect your child during their recovery for weeks and possibly even months following a concussion. These are important to look for to assess the progress of your child's concussion. They include difficulty concentrating or remembering things, sensitivity to light, difficulty sleeping, and behavioral changes that may affect your child during their recovery. Since every injury heals at its own pace, it is often difficult to predict how long it will take for someone to recover from a concussion. These are some things that should be followed to help your child make a faster recovery. It is most important to stay patient, talk to your kid about how their symptoms feel, and allow them to rest a lot. Take this process very slow. Assess your child's symptoms and pay attention to their specific needs every day to ensure the brain is fully healing properly. There are two paths to recovery that a kid should follow in order to return to their normal, everyday activities with complete healing of their brain. They are return to school and return to sports. Let's start by looking at how to help your kid return to school after a concussion. The first and most important step is to take time off from school and other activities like video games, physical activity, and reading for the first few days after injury. This is crucial because complete rest at the beginning of this process will greatly benefit your kid as they continue to get better. Then, slowly start reintroducing activities as symptoms begin to lessen. Your kid can begin low-stress activities like reading and watching TV. Don't move on to more strenuous brain activities until your kid can do the previous ones without feeling any of the concussion symptoms. The next step is to begin studying again for short amounts of time. Have them include breaks in between study times according to how ready their brain feels. At this point, your kid can begin going back to school, but only part-time for a few hours a day. Be sure to communicate with the teachers to ensure there is proper support for your child as they make their way to a full recovery and return to school. Once they are able to do homework and attend school without experiencing concussion symptoms and headaches, your kid is ready to attend school again full time. Talk to the teachers to make a plan that allows your child to get caught up on their work at a pace that is comfortable for their recovery. Now let's look at the return to sports path to recovery. These steps will help your kid continue playing the sports that they love as soon as they can. In order for your kid to return to their full sport, be sure to follow the same idea of gradual increase in activity as symptoms get better. After taking enough time to fully rest right after the injury occurs, your kid can begin with some light exercise like walking or jogging or anything that is not too strenuous. Have your kid take it easy until they are able to do these light exercises without experiencing any concussion symptoms. The next step is to move on to individual skills practice, which allows your kid to get back into practicing for their sport again without exposing them to contact from other players. Slowly increase the amount of play and intensity as your kid's symptoms continue to improve. Begin going back to team practice while still being cautious of contact from other players. Once successful practicing takes place without any symptoms, your child is ready to return to play. Keep this process gradual and controlled so your kid is not rushed back into an activity that may harm their recovery process or make their symptoms worse. Now you know how to recognize a concussion and help your kid make a full recovery.